In general, the main causes of anemia include impaired or decreased production of red blood cells by the bone marrow due to nutritional deficiency, for example, iron deficiency and vitamin B deficiencies. Bone marrow failure, for example, as seen in aplastic anemia and myelodysplastic syndrome, or diseases that involve the bone marrow, for example, infection, lymphoma, and solid tumor, and the loss of red blood cells due to bleeding or due to increased destruction of red blood cells, as seen in hemolytic anemia. Now, let's get to discuss therapeutic choices. In this session, anemias responsive to pharmacologic therapy will be discussed. These include anemias due to iron, vitamin B12 or folate deficiency, or anemias responding to erythropoietin therapy. The goals of therapy here are to alleviate the signs and symptoms of anemia, to determine and address the underlying causes of the anemia, to restore normal or adequate hemoglobin levels, thereby improving the quality of life, and to prolong survival. Now, let's get to discuss anemias that are responsive to pharmacologic stimulation of erythropoiesis. Most patients with nutritional anemias, hemolysis or bleeding have elevated levels of endogenous erythropoietin. However, there are situations in which pharmacologic stimulation of red cell production using erythropoiesis stimulating agents is beneficial. The choice of agent and dosage regimen varies according to the clinical situation. Both the available agents may be given by intravenous or subcutaneous injection. Epoetin alpha is a recombinant human erythropoietin with a relatively short half-life that is typically given at least 3 times per week. It may also be administered daily in the preoperative surgical setting where a more rapid rise is desired. Although erythropoiesis stimulating agents have improved the quality of life in patients with anemia due to chronic renal failure, they did not improve the quality of life or fatigue in patients with anemia due to AIDS or cancer.